Now we'll complete our picture by looking at three big external muscles: pectoralis major, latissimus dorsi, and deltoid. Of these, the first two have much in common: pectoralis major on the front and latissimus dorsi on the back. These two are alike in that they both pass directly from the trunk to the humerus, bypassing the scapula. Between them, they define the posterior and anterior walls of the axilla. Pectoralis major arises from the medial third of the clavicle, from the front of the sternum, and from the front of the first 6 costal cartilages. It's inserted here on the anterior edge of the bicipital groove. Pectoralis major is a powerful adductor of the humerus. When its adducting effect is held in check by other muscles, it also produces internal rotation. Latissimus dorsi has a very wide origin. It starts here under the tail end of trapezius at T7 and goes all the way down to the sacrum and out onto the posterior iliac crest. It also has some fibers arising from the lower 4 ribs and occasionally from the tip of the scapula. It inserts here on the posterior edge of the bicipital groove. To get to its insertion, the latissimus tendon has to spiral around teres major. Here's teres major. Latissimus spirals from the back to the front, with the lowest fibers of origin ending up highest. Latissimus dorsi, like pectoralis major, is a powerful adductor of the humerus. Acting through the humerus, it's also a powerful depressor of the scapula, powerful enough to overcome the whole weight of the body, as in doing a push-up. Last of all, here's the deltoid muscle. It completely surrounds the shoulder joint, from the front to the back. It arises from the spine of the scapula, from the acromion, and from the lateral third of the clavicle. It's inserted here on the deltoid tuberosity of the humerus. The deltoid muscle has multiple functions. It's almost like 3 different muscles. Its anterior part is a powerful flexor. Its posterior part is a powerful extensor, and its lateral part is a powerful abductor. Now it's time to look at the muscles which hold the scapula in place and move it in relation to the trunk. There are 6 of them, 4 on the back, 1 in the front, and 1 underneath. The one on the underneath is the large and powerful serratus anterior muscle. This is just part of it. To see it all, we need to move the scapula away from the body. This big expanse of muscle is all serratus anterior. It arises from the side and front of the first 8 ribs. It runs back under the scapula, and it's inserted all the way back here along the medial border of the scapula. When the whole serratus anterior muscle contracts, it pulls the scapula forward around the rib cage. That's protrusion. When its upper or lower fibers contract separately, they help to produce downward or upward rotation of the scapula. Now let's look at those 4 muscles on the back. 1, the trapezius, is large and superficial. The other 3 are small and deep. The 3 deep ones are levator scapulae and the 2 rhomboids, rhomboid minor and rhomboid major. Levator scapulae arises here on the outermost point of the first 3 cervical vertebrae. It inserts here on the upper medial corner of the scapula. Levator scapulae helps to elevate the scapula. The rhomboids arise here from the 4th cervical to the 5th thoracic vertebrae. They insert here along the medial border of the scapula. The rhomboids elevate and retract the scapula. The large muscle which overlies these 3 is the trapezius. It's a beautiful but complicated muscle. The trapezius has an upper part and a lower part, which both converge on the spine of the scapula. The upper part of trapezius arises from the occiput, and from the nuchal ligament, and from T1 to T3 in the midline. It's inserted along the upper edge of the spine of the scapula, around the acromion, and along the lateral third of the clavicle. The lower part of the trapezius muscle is not so massive. It arises from T4 to T12 in the midline. It inserts here on the lower edge of this part of the spine of the scapula. When the whole of trapezius contracts, it powerfully retracts the scapula. When the upper part contracts, it powerfully elevates the scapula. Last on the list of muscles passing from the trunk to the scapula is the one on the front. It's pectoralis minor. Pectoralis minor arises between the second and the fourth ribs. It's inserted on the coracoid process. Pectoralis minor produces depression of the scapula. There are two very small muscles to mention just for completeness. One is subclavius, which goes from the first rib to the clavicle. Its function is uncertain. The other is omohyoid, which arises from the hyoid bone way up here and inserts over here on the upper edge of the spine of the scapula. Its function is to depress the hyoid bone and the larynx.